Simon Cos, I could have got you to set this up the amount of times that we've done these conversations here. You've been, I think this is the 73rd time we've done an interview. No, it's... okay, we'll get there in time. But it's always great to sit down and have a conversation with you, and it would not be a digital health event without you present. So thanks for swinging by. So Microsoft here at Digital Health Week in New Zealand. What have been the conversations you've had over the last couple of days?
It's a really interesting one because we backed it up. It was at Hamilton last year.
Yeah.
So same place, but a different tone because there's been some changes to Whatuora New Zealand Health structurally and fiscally. And so I wasn't sure what I was stepping myself into. I had a presentation that I did today that I specifically rewrote because I thought going AI might be a bit tone deaf when there's some more basic digital building blocks that need to occur. But what I've found is at the conference, there's a split. Obviously, some people are heavily impacted by the change in strategy, but at the same time, I've had discussions with clinicians who are coming out of the hospital and they're here and they're saying, what a breath of fresh air it is to take a step out of the day job, focus on the future, see what's possible, and there's a really upbeat vibe. So attendance is a little down, but it's still the HiNZ we know and love.
Yes, absolutely. And it's, I think someone said it best as well too. I'll have to try and remember who that was, but it was I totally agree that, on one hand, having a conference about innovation is now the best time to do it, but what better time to bring people together in a time of change and disruption, I guess, to be able to then, as you say, reflect, restructure and perhaps look with, be it some, might not be optimism to the future, or at least some a bit more clarity or some shared learning as perspectives, because, we're all in this together. So it's a good time to come together.
Sometimes having a shift in direction or budget constraints forces you to get really focused on what you're trying to do. And a huge budget would enable you to think a 10-year strategy to roll out electronic medical records from the ground up, which is one way to proceed. It's how we've traditionally done things.
Yep.
But now, if you've got budget constraints and an imperative to deliver dividends back to the clinicians who are doing it tough at the coalface, who are under workforce pressures and drowning in administrative overload, maybe you can do things like unlocking the data that's there. There is plenty of digital data, even without a digital record. So that's where I decided to go with my presentation. We had a leadership breakfast this morning, and that was the tone of the discussion of the panellists. How do we do something in the short term that delivers value?
Yes.
And that feels really good, rather than saying, all right, in 10 years' time, it'll be great, just trust us.
Yeah, and I think there's it does bring to light, there's some immediate foundational things, but also quite, not transactional, but like quite specific actions that can be taken within health systems. And I think those are the types of, be it micro transformations or at least improvements to workflow, or just making the lives of, or perhaps doing more with less within a clinical setting. But you need those examples of transformation, innovation, or incremental improvements within digital health to be able to then demonstrate larger things at scale too. So, there's a few good examples here. And so Microsoft also works with a lot of different partners that I can see out on the expo floor too. It's been a good opportunity for you to connect with some of them as well.
So I look around and I realise now that I'm part of the furniture. I know it seems like I know half the people who are here, which is great, because it shows what a thriving community is. There's continuity over years. But yes, Microsoft is a channel business. We do everything for our partners, and there's lots of them out here, which is great. The other reflection, even though we have got a hard reset, as Dr. Lester Levy is terming the reform that's going on and the change in strategic approach, there's adoption of digital technologies at the ground level. So most of the transformation has been delivered top-down, strategically, quite prescriptively deterministic, but the adoption of AI technologies, it's out there, especially ambient clinical scribing. It seems to be the tone of what everyone's talking about. It's the first use case that people have seen and experienced, and it's magic. Like, it's delivering real time, efficiency and quality savings back to general practitioners and outpatient specialists. So there's a lot of talk about that. I just came out of a session where the presentations have all been brief, 15-minute presentations, but there was Q&A time, and they over-indexed on the people who presented on ambient clinical scribing technologies. That's a hot button.
Yeah, it is. It is like, and it's interesting seeing a. I've talked about this before too. Is that historically we've talked about GPs where someone might say, oh, GPs are slow to adopt technologies because and it's stuck in their ways. But then as soon as you put a good piece of technology that's easy to adopt and that solves a real problem, it's up like that. And that's
that is the stereotype, right? The stereotype has been clinicians are curmudgeons, and that's the reason why nothing goes. And you try and introduce new technologies, they complain, and it wasn't made here, and we hadn't have input. But I think what we've seen during COVID with adoption of virtual care technologies, and now with ambient clinical scribing, if you get the right technology that delivers value and it's intuitive enough that like you just pick it up and use it, then clinicians will jump at it.
Yeah, absolutely. Something else I've noticed from this event too, even down in Hamilton, New Zealand, the international representation is really strong. And my reflections, even over here at the interview zone, in some of the discussions with people from the US and the UAE and other parts of the world, they're taking a lot back into their regions too, which did remind me that even when you're in the thick of it and you're feeling the struggles or constraints firsthand, there's a lot of good that's happening within the region too. And I guess Microsoft, you see things globally. Is there anything that you're seeing in New Zealand that can perhaps go into other parts of the world or vice versa, or taking that international lens to this event?
So I love that. We are quite outward looking in the Australia-New Zealand region. We look to the US, we look to the UK, we look to the Nordics, we look to Singapore, we look to the UAE. But I'm not sure to what extent those countries look to Australia and New Zealand for some of theirs. So we heard from Austria today, we heard from Dubai, we heard from the US, and it's really interesting. They've all framed up their countries humbly, saying, the UAE is a small country of X amounts of citizens, or Austria is this part of you, like we've never heard of it. But I think we've looked at those with admiration for some of the things that they've done. It does remind me that we're behind the innovation curve. So we have been a lagging adopter of some technologies that others have done earlier. But in other regards, how we digitally enable some of our new models of care, we've got some of the best examples in the world. The problem is we don't scale. So we deliver hospital in the home, community nursing, self-directed patient care, all of these things. We know they work, we know they make a difference, yet at the end of the day it comes back to how you reimburse and incentivise and policy and all the rest of it. And we don't have that yet to make it scale.
Yeah.
So inside Microsoft and inside the industry, I've taken it on myself over the last couple of years to put this region on the map. And some of the stuff that we've been doing is groundbreaking. So in my presentation today, I covered what New South Wales Health have done with their operational data store platform.
Okay.
So the ODS is essentially a data lake. They put in their EMR statewide, and then they realised they actually needed a system of insight to normalise and aggregate that data. And then once they'd created that, they realised they could just put views on top of that to do demand capacity modelling, to do risk of hospitalisation during COVID, to elective surgical dashboards, to non-emergency patient transport, all the rest of it. So my presentation was an absurd idea that maybe you could do that first before you put in an EM. Now that's a crazy idea, but we know it needs to be done. If you don't have the budget or the intent to do a system of record, maybe you can do your system of insight and get some value on the ground.
It's a fresh approach, and we need some new ideas. So, some good thinking there. Lastly, any final thoughts or takeaways or things that you hope that attendees might walk away from this event with?
So I think they're going to leave Hamilton this year saying, my goodness, what a great place it is. I think we've had unseasonable weather.
Oh, it's been great.
And it's been absolutely glorious. I haven't had a go at the pinball machines and the arcade machines, but I saw them down the back of the exhibition. It's a PO on board. Yeah, it's busy. I'm working. Yes, I am. I'm working. But I might find some sticky time to blow off some steam at the end of today there.